Okay, we are going to do the inserting of the NG tube. The first thing you want to do is check your physician's orders. You want to identify your patient by 2 identifiers. Have them say their name, date of birth. You'll check their armband. Wash your hands. You want to put on your gloves. Okay, then you want to make sure your patient is in the high Fowler's position. We're going to get a cloth. We're going to drape it over her chest. Just like that. You're going to have them check their nose for patency. So she's going to hold one side of her nose and breathe. Make sure it's good. Next thing we're going to do is we're going to have to measure. Alright, so we got our tube here. Then what we do is we're going to stick it on the tip of her nose. We're going to go to her ear. We're going to wrap it around. We're going to come all the way down to the xiphoid process. Just make sure that goes around her ear comfortably. So we'll say it's about, we'll go with 25. And put our tape around the 25. Okay, next thing we're going to do is we're going to lubricate our NG tube. We're going to use a water-soluble lubricant. We're going to have the patient hold some ice chips in case she needs it. We're going to insert the tube in through the nostril. Make sure she's still breathing. We're going to have them touch their chin and swallow. Okay, and you'll have it go to about where the tape is. So we'll say that's in. And you want to put it around your ear and put a little piece of tape on her cheek just to hold it in place. Okay, so we have the tube placed, we have the tape placed on her face. We're going to do a chest x-ray to make sure the tube is placed where it needs to be. And then we're going to attach the tube to the suction for feeding, which will go down here. Then we're going to record the procedure. We're going to record or put the size and the type of the tube that we used. We're going to put any descriptions of the gastric contents if there's any. We're going to put that the placement was verified either through a chest x-ray. And then we're going to document the patient's response. Okay, pause. Okay, now we're going to show how to do the tube feeding. It's going to be the same way. You're going to verify your physician's orders. You're going to identify your client. You want to do hand hygiene, wash your hands, put on your gloves. The next thing you want to do is you have your formula already. You're going to shake up the formula. Make sure the client's positioned in the high Fowler's position, which she is. You're going to verify your tube placement by checking the pH. You want to make sure you flush it with about 30 milliliters of water. We're going to attach the feeding tube to the NG tube. And then you're going to make sure you check your residuals every 4 to 6 hours. And then you want to document your feedings, your residuals, appearance of the site, if they were nauseous, how they handled it, how much they took, the input and output. Okay, and then, you ready? Mm-hmm. Okay, and then the last thing we're going to do is we're going to remove the NG tube. So, of course, you want to verify your order. You want to identify your client, wash your hands, put on your clean gloves. We're going to disconnect the NG tube from the suction. Make sure it's clamped. You want to place a towel around their chest just like you did when you were placing the NG tube. You want to make sure you tell the client to hold their breath. Have them hold their breath, and then you're just going to slowly pull the tube out. Make sure they're still breathing. And then you just want to properly dispose it. Then remove your gloves. You're going to wash your hands, and then you're going to document the procedure and how the patient handled it. That's it.